Good evening. She's been a Toronto area councillor and the provincial minister of health. Elinor Caplan's list of accomplishments is a long one. Today, the now retired politician was at Queen's University talking about something she is very familiar with, the Canadian healthcare system. Newswatch's Darren Davis reports.
With over 20 years of public service under her belt and much of it focused on health care, Elinor Caplan spoke to a crowd of over 100 people, telling them what she feels is wrong with health care in Canada and what needs to be done to improve it. Caplan says there are two main criteria that Canadian health care needs:
accountability and transparency, and I think we need both of those in order to get what the taxpayer wants, which is high quality, safe and affordable care, as well as value for their tax dollars.
Caplan says health care in Canada is publicly funded and privately administered, and the current fee-for-service payment system needs to change. She says any attempts by government to change the system has been hindered by the Ontario Medical Association.
I would recommend to government that they take away the union status, which was conferred on the OMA, and that they also take away the policy veto, which is making it impossible for government to engage doctors directly, to work with government to make the changes that are necessary.
And the one-hour lecture seemed to resonate with some of the students who made the trip to Queen's Wallace Hall.
She gave a lot of really good background on the problems that we have, and it was just very blunt and a very frank look at her experiences and what are the existing problems since 20 years ago.
It's hard to get cooperation between the government and the medical professions and dentistry and all those healthcare professionals. I guess it's all about making healthcare professionals aware and being more open-minded and just improving collaboration.
Darren Davis, CKWS Newswatch, Kingston.
Caplan's visit is part of the Duncan G. Sinclair lecture series on health services and policy research.